And thank you to all the panelists in session 2. This was a really great session, not only the initial discussion and presentations, but also the lively discussion and great responses. We really appreciate it. This brings our first session of our 3 sessions. The session today focusing on structural and social determinants of risk. Just a wonderful set of presentations, beginning with that of Dr. Williams, who set the stage for us, and then the first session on neighborhood and built environment, and then the second session on social and community context. We really heard so much about the urgency and the opportunities for thinking differently about health disparities and ways that are more engaging of diverse communities and could have a big impact in our society. I just want to thank you all on behalf of the Neuroscience Forum of the National Academies, and then pass it over to Dr. Hurd to bring us home.
Thank you very much, John. And as you said, definitely want to thank the Dr. Williams and the panelists from both sessions. I really think that it emphasizes, what we're dealing with here. The structural factors that are leading to health disparities. And importantly, I think that the panelists and everybody, I think, can understand that a number of these are preventable. They're modifiable. When you think about aspects of early life intervention, and probably my bias for the research that I do, and substance use disorders and developmental impacts of that, there's a lot of things that can be done early. And the issue of basic communication that was, engaging in communities, thinking about culture, and yes, in terms of getting the right experts and making sure that everybody is part of the research that we do, not just the scientists, but what types of scientists are involved, and having engagement from the community. Without a doubt, we need to communicate better. And I think that's one thing that was emphasized today as well. Bringing in experts who are communication experts, since many of us are not that. How do we make sure that we engage the right people? So with that, we thank everyone, and want to again emphasize that they're continue to ask questions. The speakers will continue to answer them in the QA section of the live stream. Our next workshop will be on disparities in access to care, which will begin at 12 p.m. on April 18th. And this virtual workshop will discuss what common disparities exist across a variety of service environments, and consider case studies and models of research approaches that will enable better inclusion of underrepresented and excluded populations. The final workshop, moving forward to drive transformative change, will begin at 11 a.m. on April 25th, and explore the role of different stakeholders to move the field forward in an ethical manner to increase diversity of the neuroscience workforce, enhance community partnership, and facilitate multidisciplinary collaborations to drive, as I said, transformative and sustainable change in research and clinical care. So please take the brief survey to share feedback about the workshop, and note that the recordings and the presentations of this workshop will be available in about 1 to 2 weeks. Thank you once again. We really appreciate your participation and attendance. Thank you.